Great.
Yeah.
All right. I'm a 40-year-old male. 2 months ago, I had all four wisdom teeth removed. Since the extraction, tooth has been getting stuck between the first and second molars on both sides of my upper teeth. Could this lead to bone loss? If so, what should I do to address it? Please help.
Okay, so after the removal of the wisdom teeth, if you're particularly noticing food packing, I want to make sure that I answer your question right. You said the food has been getting the food has been getting stuck between the first and the second molar.
Correct.
So when you say a first and the second molar, we are not talking about the back of the second molar where you actually got the tooth removed from. So we are not talking about a wisdom tooth problem here. It is not because you had the wisdom tooth removed. And more than likely, you probably, even before you got the wisdom tooth removed, you probably had this problem of the food getting stuck in between the second and the first and sorry, the second, first and the second molar. Yes, the first and the second molar, which is a completely different problem than the wisdom tooth. So I'm so glad you already got the wisdom tooth removed, because that can again contribute to the gum disease. So if you already got the wisdom tooth removed, now you have to address the food packing between the first and the second molar, because what we normally say is we call them as contact. So the teeth need to be tight like this. Can I borrow your hand? Do it like this for me. So when the teeth, do it like that. Okay, so when the teeth are tight, so when the food goes in between, the food kind of deflects away. So when the teeth are not tight, show them like this, right? So when the teeth are not, so when you bite down, the food kind of goes down. So it hits the gum tissue like that. So you don't want the contact to be open. So that's why it is critical. You need to get that checked out. Again, talk to your dentist to see whether you have an open contact between the first and the second molar, which may be causing the food packing. And if so, then the dentist can do some adjustments, either a filling or maybe a crown, or maybe even do some braces to bring the teeth together. And and again, make sure they attend the gum disease, and this is going to prevent the food from packing and prevent any type of bone loss or gum loss, and eventually the tooth loss or even cavities and such. So talk to your dentist, or if you happen to be in the Dallas Fort Worth area, come see us and we can help you at ToothHQ.
Definitely.